Hey everyone, and welcome. When we think about surgery, we usually picture it as a solution, right? A specific problem, a procedure to fix it, and then a recovery period. But what happens when the recovery never really ends? For millions of people, surgery leaves behind this hidden cost, chronic pain. So today we're going to dig into this really common but often overlooked outcome.
All right, to really get a handle on this, let's start with the sheer scale of it. Every single year, around the world, there are over 300 million major surgeries. Just think about that number for a second. That is a massive number of people going under the knife, all hoping to feel better, to improve their lives.
But here's the kicker. This is the stat that's truly mind-boggling. Depending on what kind of surgery we're talking about, up to half of those patients, end up with chronic pain afterwards, pain they didn't have before. We're talking potentially 150 million people every single year. It's just, wow.
So what is this lingering shadow that surgery can cast? Well, it actually has a medical name, chronic post-surgical pain, or you'll see it called CPSP. And getting a clear idea of what it is, and just as importantly, what it isn't, is, step one.
Now, this isn't just a vague, I still hurt after surgery kind of thing. The experts, the International Association for the Study of Pain, they have a really specific definition for it. To be diagnosed with CSP, you have to tick certain boxes. It's a real distinct medical condition.
So let's break that down. It's pretty straightforward, really. First, pretty obvious, the pain has to show up after the surgery. Second, and this is key, it has to last for at least 3 months. We're talking way past the normal ouch, I'm healing phase. And finally, your doctor needs to make sure nothing else is causing it. Like an infection or the original problem coming back.
And I really want to hammer this point home. This is not the normal pain of recovery. Feeling sore while your stitches heal, that's totally expected. That's your body doing its job. CPSP, that's different. It's like the pain alarm in your body goes off and then the off switch breaks. The pain signals just keep firing long after they should have stopped.
Okay, so if this can happen after pretty much any operation, it begs the question, who's most likely to get it? Well, researchers have been digging into this, and they've found some pretty clear risk factors. And what's really interesting is that the risk is all over the map. It totally depends on the surgery you're having. For something like a dental procedure, the risk is pretty low, maybe 5 to 13%. But then you look at major surgeries like an amputation or a thoracotomy, that's opening up the chest, and the risk just goes through the roof. We're talking up to 85% in some cases. So yeah, what you're having done and where matters a lot.
But it's not just about the surgery itself. A bunch of other things play a role. There are patient factors, like your age. Younger people are actually at higher risk. Your sex. Women tend to be more at risk. And obesity. And here's the big one, your mindset going in. If you have a lot of anxiety or depression, or if you're someone who tends to catastrophize pain, expect the absolute worst, that's a huge red flag. Then, of course, there's your own history with pain and, naturally, what happens during the surgery, especially if a nerve gets damaged.
So with all these risk factors, you can see why the thinking has shifted. It's not just about treating the pain if it shows up. The best strategy is to go on the offensive, to try and stop it from ever becoming chronic. And that's where this idea of a multimodal defense comes into play.
And listen, this isn't just some new age idea. This is the official recommendation from groups like the American Pain Society. Their guidelines, based on tons of high-quality evidence, say this is what clinicians should be doing. They call it multimodal analgesia.
Okay, multimodal analgesia. Sounds fancy, but what is it? Think of it this way. Instead of relying on one superhero medication to save the day, you're sending in a whole team of specialists. It's about fighting pain from lots of different angles at the same time. You use different drugs, different techniques that all work in slightly different ways. And when you combine them, they're way more powerful together than they would be alone. The whole is greater than the sum of its parts.
So what does this team look like in practice? Well, it might mean using a nerve block or an epidural to numb the whole area. Then you add in a non-opioid painkiller like ibuprofen. And maybe on top of that, doctors add in other types of meds and even things that aren't drugs at all, like cognitive behavioral therapy or CBT. You're building this layered, comprehensive shield against the pain.
But look, sometimes even with the best prevention, chronic pain still happens. So what then? Well, that's when the game changes from prevention to long-term management.
The good news is, the treatment toolbox is also packed with different options. It's multimodal, too. On the medicine side, you've got things you might not expect, like certain antidepressants or anticonvulsants, plus topical stuff like creams and patches, or even targeted injections. But, and this is so important, that's almost always paired with non-drug approaches. Things like a TENS unit, that little device that sends electrical pulses, or psychological therapies like CBT to help you manage the pain and get your life back.
And this really has to be said. There is no single magic bullet here. No one-size-fits-all treatment. CPSP is super complex. It involves your body, but it also involves your brain. So getting it under control means creating a totally personalized plan. It has to be tailored to you, your pain, your history, and what you want to achieve.
And that idea of personalization, that's really where the future of all of this is headed. The Holy Grail isn't just getting better at treating chronic pain, it's about being able to predict it and then stop it before it even starts, one person at a time.
Right now, there's this huge study happening in Denmark that's really paving the way. Researchers are following more than 1,500 patients who are having surgery, and they are collecting just a mountain of data on them before, during, and after the operation.
And what's the goal of all this data collection? It's actually pretty simple, but it's a total game changer. They want to build a better predictor. They're trying to use all that info to create a tool that can pinpoint who is at high risk with way more accuracy than we can right now.
And the end product here isn't some dusty academic paper. They're actually building a CPSS risk calculator. Imagine this, a simple tool, maybe even an app on your doctor's phone. They could plug in all your info, your age, the type of surgery, your anxiety levels, and it would spit out a risk score, a clear percentage chance of you developing chronic pain. That changes everything. It means you and your doctor can have a real conversation and decide on a super aggressive, personalized prevention plan if you're high risk.
So I want to leave you with this question. Just imagine, what if your doctor could sit down with you before your surgery and say, okay, based on the data, your personal risk for chronic pain is about 40%, so here's the aggressive multi-step plan we're going to use to get that number as low as possible. Wouldn't that be incredible? Well, that's the future this research is working towards. A future where surgery's hidden cost is no longer hidden, but something we can predict, manage, and hopefully prevent altogether.